Welcome to everybody just arriving. We're so glad that you're here. We will be starting in a few minutes. We're letting people in from the waiting room. Please be aware the session is being recorded. Please mute your microphones and turn off your cameras. During the Q&A after the talk, we're going to have plenty of time to turn our cameras back on and go ahead and engage with Dr. Lindgren directly. Please put your questions in the chat. You can do so anytime, including now. And after the brief discussion is over, we'll start the Q&A and Jennifer will be calling people off the list. We look forward to seeing you then. The event will start in a couple of minutes. Welcome everyone to the Aerospace Medical Student and Resident Organization official kickoff. While we're still slowly yet surely letting people in from the waiting room, we'll go ahead and start to do a little introduction about our organization and our very special guest that we're very excited to have, Dr. Astronaut Kjell Lindgren. So thank you all for coming today. Briefly, what is this host organization? What are we doing here? Who are we? Well, WashU is now the home of a branch of an international organization. As of today, taking it away, you are now taking part in the launch of the Aerospace Medical Student Resident Organization branch at WashU. But AMSRO, as it's called, has been around for quite some time. It's essentially the education arm of the Aerospace Medical Association, which is International Association of all space doctors. And what space doctors are people who take care of those living and working in extreme environments. Space, also divers, a lot of wilderness medicine is involved, and a lot of medicine in special circumstances, bariatric chambers, altitude chambers, things like that. There's always been, since there's been people going to high places and low places, there have been space doctors, and we are the education branch of that. We welcome medical students, residents, graduate students, allied health professionals like pharmacists and therapists, and also undergraduates. If you are interested in getting involved in aerospace medicine in any way, clinically or by research, we welcome you. AMSRO is trying to get you opportunities that you want and need to take your career where you want it to go. Research, mentorship, networking, either in person or virtually. WashU AMSRO was started because we want to bring space medicine down to earth, down to you. There's so many opportunities here in St. Louis to get involved with Boeing and with other local Air Force Base at Scott. So we're going to hopefully get you guys more of that information. Stick around after the event with Dr. Lindgren if you want to be more involved. But in the meanwhile, this is what today's event is going to look like. We're going to have the keynote address by Dr. Lindgren himself, followed by a Q&A. During that Q&A, Jennifer, one of the 3 student leads of WashU AMSRO up there with Sean and Garrett, are going to be here to pick people off of the chat list and have them turn on their cameras and turn on their mics so you can talk directly to Dr. Lindgren. So please stick around. If you put a question in the chat, your name might be called and then you get a chance to talk to him directly. After all that, for those of you interested, we'll have an official AMSRO meeting where we'll get to tell you more about what it is that our organization does. But in the meanwhile, the reason that you all came, Dr. Lindgren. Kjell, are you with us? I want to make sure he can hear me before I go off.
I am.
Welcome. Thanks for joining us today.
Thank you so much. I'm excited to be with you guys today.
So I'm gonna turn everything over to Dr. Lindgren to do his thing in a moment. But what I want to tell you all is a little bit about Kjell. And I could go on for a long time. Kjell's done a lot of really cool stuff, from jumping out of planes to being an Eagle Scout. He's a science fiction fan, which is the reason why he and I have hung out. My husband's secret identity is as a science fiction writer. He's also a professor at WashU. But we've gotten to hang out with our mutual science fiction friends at conventions, which is a very good time. But the reason I actually know Kjell is because I was the doctor on a 366-day Mars simulation. And it was tough. I was the only medical person on the whole mission. Narcan was made legal. Intranasal Narcan was made legal by the FDA during my mission. And I ran out onto the landing and said to the rest of my crew, hey, everybody, guess what? Intranasal Narcan is going to be publicly and easily available. And a space architect, an engineer, a geologist, an astrobiologist all looked at me and said, that's good, right? I was the only medical person on simulated Mars, and it was very lonely, and sometimes it was very scary. And I wasn't really sure how to handle it, so I decided to write to the only person who I thought could maybe give me some tips, some advice to help me get through it, and that was Kjell. He was on the International Space Station at that time, spending 140 days in space. So I said, Kjell, how do you be the only doctor in space? I don't know how to do this. And Kjell said, don't worry. Don't worry. You're not the only doctor. I mean, you need to be a resource for your crew, but there are many space doctors. You're part of a community. They will be there for you. You are not alone. And that helped me turn a corner. That made a real difference for me. So Kjell, thank you so much for being there for me.
It's a pleasure. I love that story.
I love it too, because part of the reason why we're all here today is when I got back to Earth, I said, you know what, we need to have a bigger community and help more people understand that they are not alone. So speaking of space and not being alone, take it away. You're here today to talk to us about whatever you'd like to talk about. We can't wait to hear it. The floor is yours.
Awesome. Thank you so much. Sorry, I'm getting texts on my computer. All right, I'm going to share a screen with you here. All right, can everybody see that okay?
That looks great.
All right. Well, again, I just want to thank you for this opportunity to chat with you all. I know it's a very challenging time just starting medical school, and being in medical school is challenging on its own. And to have COVID overlaying all of this, changing the way that that we're learning medicine, and changing the way that you all are interacting with patients, with your colleagues, with your faculty. I can't even begin to comprehend how challenging that is. And so, so I congratulate you on your accomplishments that have gotten you to this point. And I encourage you, as you continue to work towards this very important service that you are going to be providing to our communities and to our country. And so hopefully this presentation can take you out of that a little bit. But what I wanted to do was just kind of share with you a little bit of what my journey was like, and really kind of reinforce how similar what I'm getting to do right now is with what you are learning in the classroom and on rotations. So I'm going to talk on, I think, 3 major topics. I want to keep it kind of short so that that we have an opportunity for questions and answers a little bit later. But before I do all that, I'll just kind of share with you my background, and actually I'll take it off of the presentation right now just so that I can see you all. While I'm talking. All right. So I wanted to, so I wanted to be an astronaut for as long as I can remember. I started that dream, I think, really took a hold of me at a very young age. Interested in science fiction, as Dr. Gifford mentioned, and that was both the written word and movies. And then it was really in 1981 when I saw the first space shuttle launch that it really struck me that, hey, this is something that we can actually do. And that's when the dream really gripped me. And so we didn't have the internet back then, so it was really reading biographies of early astronauts and histories of the space program that I tried to define a path on how I could get from where I was to having that opportunity to fly. And uh, and and all the astronauts back then were test pilots. So I decided, well, I need to become a pilot. And I grew up in an Air Force family, for the most part, living overseas in England. And so I decided I wanted to go to the Air Force Academy, and ultimately had the great fortune to be able to do that. And then decided that I was gonna fly. So there are some twists and turns there. But a part of it is actually coming to the realization that becoming an astronaut, as you grow older, you still have that dream, but you also recognize that this is something that probably the odds are not stacked in your favor. Let's put it that way. And so you really need to pursue something that you have a passion about. And for me, that was medicine. And so I studied pre-med and in undergraduate, with the desire that ultimately I wanted to go into medicine. That's a domain, much like you all, a domain that is very challenging, but also one that serves the community. And that really appealed to me. And so that's the path I took, but still retaining this desire to maybe get to work in human space flight at some point. So I continued to pursue that. The idea of working with NASA someday, but really focusing on the now. And that involves emergency medicine initially for me. And then as I was finishing up emergency medicine, that desire to still work with human space flights stayed with me. And so I went on to do a second residency in aerospace medicine down at Galveston in Houston, Texas. Galveston, Texas, and then got a job as a flight surgeon at NASA. And it was while I was working for NASA that I applied to the astronaut office during a selection in the 2007-2008 timeframe, and then was selected into the 2009 astronaut class. And that has been an amazing, it was an amazing journey up to that point, very challenging, and the past 11 years have been amazing as well. I had the opportunity to fly in 2015. I spent a little under 5 months on the International Space Station, right in the middle of Scott Kelly's one-year mission. And so as a physician, that was very, of course, a very interesting opportunity to be a part of something like that. So what I wanted to do was just kind of then compare and contrast a little bit of what your experience is like and what our experience is like in the astronaut office, and speak specifically to some of the kind of major domains and expectations that you are going to encounter as you move through your medical student career, your resident career, and then ultimately as a physician in whatever specialty you decide to practice in. So let me zip back to the presentation here. And the first thing that I want to talk about is leadership. Or I'm sorry, no, teamwork. So teamwork is, many will say that space flight is the ultimate team sport, and that is absolutely true. What you see represented in this picture is our crew, Scott Kelly in the middle there. On the left is Kimiya Yui, my Japanese crewmate, and in the back, Sergei Volkov, Oleg Kononenko, and Misha Koronenko. We have a team on the space station, but this is just one very small part of the team. We have a team in mission control in Houston, teams in mission controls all over the world, and then an even huger teams so that we have thousands of people contributing millions of hours to the success of this mission. And so I think that as you are going through your career, recognizing that as tough as things are, that you are one small part of a larger team that's providing care to your patients, that you and your patients, the patients' families, your allied health staff, and all the folks in administration in the hospital all make up a team that ultimately you have the privilege of being the hands and feet and face of healthcare for that patient. And so just remembering the responsibilities that you have, but also the privilege that it is to be in that position. We choose, a big part of that teamwork issue is that we select our folks for their teamwork skills. And so you can see this is the 2017 class that we selected and who have graduated from astronaut candidacy. We are looking for people that are good teammates. And that's a big part of why you are where you are right now. You were chosen, you went through a selection, and you were chosen to matriculate in your med school and class and in your residency. And so you have the foundations of those skills. We in the astronaut office and also within your class and residency train up those skills. And so this is a picture that was taken during one of our NOLS trips, National Outdoor Leadership School, where we train in teamwork skills and leadership and followership, learning how to be good teammates and how to be good followers and ultimately good leaders. So we work at it. It's not something that we just come in with. It's something that we actually have to work at and refine. And that is something that whether you recognize it or not, you're also experiencing in the classroom and also in on your rotations. We have the opportunity, we were chosen for a day to lead one leg of our trip. And so this is an opportunity to figure out what kind of leadership you want to use. If you want to be super directive, if you want to use a consensus. And of course, that all depends on context. The context of the environment really kind of dictates what kind of leadership is needed. And so this is an opportunity to pay attention to that and then to use the team to achieve the goals that we're trying to achieve for that particular day. So talking about that, how to be a good team member, learning how to be a good follower, and then how to be ultimately a good leader. So I'll just share a short anecdote with you on one of my experiences. This is me training on the robotic arm. So we have several disciplines that we need to learn when we become astronauts, much like all the things that you're expected to learn. We learn how to do spacewalks, how to use the robotic arm, how to work with space station systems, how to fly in the T-38 jet, and then also Russian language training. So it's a lot, it's a fire hose, but you break those down into individual disciplines and then break those disciplines down to individual skills. And we start out with very simple computer programs and ultimately get to this point where we're in a simulator using the robotic arm to capture a cargo vehicle that's coming up to the space station. And so within a month of arriving on the space station, here are Kimia and I, two rookies, capturing the Japanese cargo vehicle. So just some brief background prior to this capture, in December, so this was happening in about the August timeframe. In December of the preceding year, we lost a cargo vehicle on the launch pad, the Cygnus vehicle, as it was just getting ready to launch. And then 4 weeks prior to my mission, we lost a Russian cargo vehicle that ended up delaying our launch by a few weeks. And then when we were getting ready to launch, we lost a SpaceX CRS-7 just 2 weeks prior to our launch. So that's 3 cargo vehicles in a row, which also gives you a little pause as you're getting ready to climb onto your rocket. But with those 3 lost cargo vehicles, it meant that this particular cargo vehicle that we were capturing, the HTV, was absolutely critical to our existence on the space station. Without the consumables and equipment in this spacecraft, we would not be able to actually stay on space station for that long because we were running out of supplies at this point. Scott Kelly, with multiple missions under his belt, our space station commander, recognize all of this, but he understood. So, and we understood the criticality of this particular cargo vehicle. So as a leader, he could have been in our business and been up there with kind of telling us what to do. But he also recognized the training that we had been through. We had a common language of expertise and skill. And so the way he handled the situation is he said, hey, you know, we've got this cargo vehicle capture that we've got to do today. This is how I would set my stuff up. You might want to have the ATU, the communications box in here, set up this way, and then paper procedures available in case the cargo vehicle goes down. I'll be down in node 3. You let me know if you have any concerns or questions. Good luck. And so instead of micromanaging us, we had a relationship of trust established. He recognized our skills and he let us do our work. And so that was huge to me. I think we all recognized the criticality of this particular event. But he trusted us and I thought did an amazing job. And that leadership really stuck with me. And it's something that I try to replicate and then also teach, but it is all based on trust. And so good leadership, good teamwork is fundamentally based on trust and a relationship with the folks that are on your team. I thought I'd just throw a slide in here of some of the medical stuff that we get to do. Here's a picture. So one of the physiologic changes that happens in space is that we have a change in vision, and we can talk about that a little bit more. So we have a very robust visual ocular health program, and part of that is doing ultrasound. So this is really fun for me to get to leverage some of my skill set to be able to work. Communication is critical to leadership. And so this is a slide that just, this is a picture of my very first downlink with my family. So this is a couple of days into my space station flight. And so we get about an hour and a half of video conferencing time with our families on a weekly basis. And so this was the first time that I got to chat with them. And so that was, that's a huge behavioral health benefit and super important for these long duration missions. It's communication. It's something that we practiced as a family, and it's something that you need to practice with your teams. The trust that is involved in leadership, the trust that is involved in good teamwork is communication is the lifeblood of that, and making sure that you and your team are all on the same page. Expectations are a huge part of teamwork. And so this is a picture of me cutting my hair. I cut my hair here on Earth. I've been doing it for 20 years, ever since I got out of the Air Force. It's just too expensive. It's actually in medical school that I realized that I could not maintain a habit of getting my hair cut every 2 weeks at like $30 a pop. So I bought clippers. I cut my own hair. And so I was cutting it on station, and all of my crewmates were like, man, that's awesome. You know what you're doing. Will you cut my hair too? And I said, absolutely. You know, I'd be happy to cut your hair. So here I'm cutting Sergey's hair. Here I'm getting ready to cut Oleg's hair. So haircut, that involves trust, right? That's trust is foundational to giving yourself up to somebody else's haircut, your barbering skills. And then also this goes back to the whole history of many physicians starting out at barbers. So I enjoyed that aspect of it as well. But part of it is expectations and teamwork and leadership. And so I may or may not have set expectations with Oleg, helping him to understand that while I was very good at cutting hair, that I only know one haircut. And so everybody whose hair I cut ended up with my haircut. I think he was okay with it. He was happy with it. But again, expectations are very, very important to ensure that everybody's on the same page. And then as a leader, celebrating your team. These are, this slide is just a picture of the balloons that I brought up with me. During my mission from July to December, all of my family's birthdays occur during that time. So I had hidden presents for them at home, and then also brought balloons up with me so that we could celebrate those birthdays while I was up there. And just to talk about that leadership aspect a little bit, you may not feel like a leader right now. If you're a first year or second year student, a third year student, and you're kind of, lower than the intern on a team, you may not feel like a leader, and you have an opportunity to learn for sure, an opportunity to see different leadership styles. But we, in every aspect of our job, we are all leaders, and whether you're a leader in a particular environment, when you go in to talk with a patient on your own, you are a leader, and so understanding that, owning that is critically important, because people are going to be listening to what you say. As a medical student, when you talk with college students about your experiences, they are holding on to every word, and so remember where you came from and where you're going, and understand the gravity that your words can have. Astronauts, we do not have a lot of authoritarian type of leadership, or leadership by kind of org chart. When we're on the space station and you have an astronaut that is a commander, certainly there is a positional leadership there, but even that individual works with mission control. On a day-to-day basis, we are not at the top of many org charts, but we have a lot of opportunity to lead by influence based on experience and our job. And so understanding that and understanding how to wield that effectively is critically important. As medical students and residents, you have a lot of opportunity to lead by influence, so pay attention to that. The last thing I wanted to talk about very quickly, let's see, Shana, how much more time do I have?
As much as you want.
Okay, what's our cutoff? Is it 1 o'clock?
It is 1 o'clock.
Okay, I'll make sure I leave time for questions here. Based on my own experience as a medical student, as a resident, as a faculty, as an astronaut, if you are not encountering experiences or settings where you have anxiety or fear, then you may not be doing it right. You are in a position where you have people's lives and futures in your hands. And so if that doesn't give you a little bit of pause, then I think you probably ought to take some time to think about what it is that you're embarking upon. It is an absolute privilege to serve as a physician, walking alongside somebody that is going through what could be possibly a life-threatening issue. And so, of course, you don't want to dwell on that, but you do want to recognize the gravity of that opportunity. And so how do you even begin to work under that burden, shouldering that burden on a day-to-day basis? I don't think we can ignore it, but I think that we can categorize it appropriately. And so I just want to touch on this briefly. One of the things that I get asked a lot is, aren't you afraid when you fly? And anybody that says that they didn't have some type of fear, I think is not being completely honest with you. But I can tell you, by the time that I got ready to fly, that fear had been minimized. Fear, I think, is our human reaction to the unknown. And so just as what you were doing right now, learning, whether it's academics or going through rotations and gaining experience, training and understanding the different environments that you're going to encounter, and what you do if somebody codes, and what you do if you see a low sodium on a lab that comes back, or what you do if you see a COVID test come back positive. Learning experiencing those on a regular basis and reacting to those things, that training, the normalization of those experiences, the knowledge that you're gaining is slowly eliminating the unknown and eliminating those opportunities for anxiety and fear. And so it's by continued exposure to those situations that may give you some anxiety. Continued exposure to those situations and understanding how to react in those situations is ultimately how you diminish that fear. And so the fear of getting into, in this picture, I'm wearing my Sokol, my Russian pressure suit, and sitting in that in vacuum for 2 hours. It's not normal to go into a chamber and be exposed to vacuum for 2 hours. And so all of the work that went towards doing that, the work that goes towards, wearing a hard hat and working underwater at 60 feet of seawater, and all of the physiological changes and the risks that are associated with that, and the training that goes into making that happen. And then ultimately the training that goes into getting ready for that day where you climb onto a gantry and wave goodbye to your loved ones and all of the folks that made that day possible, climb into the top of what is essentially is a repurposed ballistic missile, and launch into low Earth orbit to the International Space Station. And so what it comes down to is training. Training for all the possible realistic contingencies, whether that's land survival training, because you could end up in a forest somewhere upon landing, or winter survival training, because you could end up in the Russian wilderness upon returning to Earth. Those were the coldest 3 days of my life. This was pretty spectacular. Not something that I would have thought was a smart thing to do, putting a fire inside essentially a teepee surrounded by a bunch of flammable material, but it is what we were instructed to do. And it was warmer, but pretty uncomfortable from all the smoke and everything that was in there. We do water survival training in case our capsule comes down in water. The Soyuz capsule is meant to land on land, but they did have one instance where a capsule landed in a lake, and so we train on how to deal with that. All in preparation to ultimately get to do this in low Earth orbit. We fly in the T-38 jet. This is, we call this our space flight readiness platform, or space flight readiness training. It puts us in a situation that is unlike a simulator, where in a simulator, if you have a bad day, you can just climb out and say, that was dumb, reset the button, and then get back in. Flying in the T-38 puts us in a vehicle where we have to work with a crew and practice good inter-crew communication, good communication with the outside world, run through procedures, and deal with emergencies where our decisions have life and death consequences. We don't want to experience that opportunity, that first exposure to being in a true operational environment where our actions have very serious consequences. We don't want that first exposure to be in space. And so the T-38 gives us a good opportunity to practice those skills. And then ultimately, I think one of the biggest practice of these skills is during spacewalks. So it is an unnatural feeling to put on a miniature spacesuit and go outside to do work. Flying 250 miles above the Earth, and for some with the sensation that if they let go, that they're going to fall off. And so how on earth do you get to the point where you are confident and their team is confident that you can pull this off? And so again, it is through training, through the pogo stand, where we learn how to use tools in that weightless environment. It's in the neutral buoyancy laboratory, where hundreds of hours give us exposure to how the suit works, how tools work, how you move around, and how you actually can be successful at doing work and responding to emergencies in a spacesuit. And again, that all leads up to a day where you actually do your pre-breathe, get into your suit, and then go outside to get work done. So that, those are three main kind of concepts that I wanted to share with you. I think that they are critically linked to what you're experiencing now as medical students. It is how to be a good team member, how to practice behaviors where you can cooperate with your medical team, with your allied health team, with your patient and family team, and what techniques you can use to be good teammates, how to be a good leader, and how to be a good follower in your domain. And then ultimately, how do you overcome the fears that you have of being a good doctor, doing a good job, feeling like you are adequate to the task that lays ahead of you. So I appreciate the opportunity to share those ideas with you. These are just a string of photos that I took from the space station, and so I'm running through those. But at this point, I am happy to take any questions that you might have.
Thank you so much, Kjell. That was fantastic. At this point, I'd like to ask all of the student leads of the AMSRO organization to turn your cameras on. That is Sean, Garrett, and Jen. Let's turn the cameras on and start inviting people to talk to Kjell and Kjell to talk to our people.
As of now, I cannot turn my camera on. Says the host has stopped it.
Oh, okay. I'll get that taken care of. Jen, do you want to start calling people from the Q&A? The other person who could do that would definitely be me. So let's see, we'll start from the top. First question came from Carly. Kjell, do the majority of doctors selected by NASA have prior military service? Carly, would you like to turn your camera on? Can you turn your camera on?
Yes.
Good.
Do you want me to just complete the question? Basically,
Yeah.
Okay, basically I have a question. So I am potentially planning on commissioning into the military, but it seems like the majority of doctors selected by NASA have prior service. And then if not, what is, a comparable civilian path to get there?
Hey, Carla, it's a great question. If you kind of look at the history of our Corps, you could make an argument that is probably the case, that the majority of the folks in our office have some prior military experience, either prior experience like myself or folks that are active duty. And so in the near past, the last three physicians have been military. In my class in 2009, I was selected, I had military experience, but my colleague Serena Anand, Chancellor, did not have prior military experience. And then prior to that, I would say that actually 3 out of the 4 prior did not have military experience. So, so why is that? We definitely do not require military experience, and especially from our physicians. If you look at the skill set that's required or that is attractive for our astronauts, you might, so we think about what it is that we're asking folks to do. We're asking them to live and work in a hazardous environment in constrained and austere conditions for a long period of time. So I think that we would describe that as an operational environment where our decisions have life and death consequences. And so we're looking for folks that have that similar experience. And I think that you could make an argument that some practices of medicine, many practices of medicine have that kind of environment. And so that may speak to why some of our physicians have an emergency medicine background, because you're in an environment with incomplete information, making decisions quickly, working with a small team. But we have family practice physicians, we have internal medicine. And so the type of medicine I think, you know, could play a role. And the military experience, I think, plays a role in that. Like in my case, I was an emergency medicine doctor, but my military experience, I was a parachutist. I had some flight training, and those things kind of lend towards that operational experience. That being said, it certainly is not required. I think that maybe it helps, but before anybody kind of decides, oh, I want to be an astronaut and I'm a physician, so now I need to go to the military. It is with the advice that I would give anybody is that don't make your choices or base your career based on what you think NASA wants. You've got to do it for yourself. So if you were entertaining the idea of commissioning and going to the Air Force, or Army, or Navy because you wanted to be a naval officer and you wanted to serve, that is the first and foremost reason. If you're going into the Air Force because you're a physician and you want to be an astronaut, and it's not really because you want to be in the Air Force, you're going to be absolutely miserable and you're not going to be successful. And that is not a good way to position yourself to be a successful applicant. So it really has to come down to finding activities and things that you enjoy doing, because you're going to be good at those, and that is going to set you up for success. And that's kind of what I think we're looking for in the astronaut office. Does that all make sense? Does that help?
Yes, thank you. Yeah, that's all
Okay.
really good advice.
That's great advice. I'd like to introduce Sean Juan, who's one of the student heads of AMSRO WashU, and he'll say hi and get the next question up for you, Jill.
Awesome.
Hey, Jill, nice to meet you. I have to run in a minute because I'm in the hospital in medicine to a cardiac cath. So just wanted to say thanks for your time
Thanks,
today.
Sean.
And I can go ahead and introduce Garang. And if you could turn on your video and ask your question,
Yeah.
that'd be awesome.
So I'm Garang. I'm a fourth year medical student. I'm in the process of joining the Air Force out of genuine interest. And I'm applying ortho with an interest in ortho trauma, hoping to match UTMB since I'm from Texas. I was wondering things I should be focused on to improve chances of selection.
Greg, you dropped out there at the end. I'm sorry. Could you repeat your question?
Yeah, sure. Sorry. I was asking, in addition to joining the Air Force and trying to focus on ortho, especially ortho trauma, trying to match UTMB, what are some additional things I should be focusing on in the next few years to improve my chances of selection?
Yeah. So if you are a medical student or if you're a resident, the most important thing that you can be doing right now is to be the best medical student or the best resident that you can be. It is absolutely appropriate to have a long-term goal of, hey, this is where I'd like to be in 10 years. But something that I really struggled with was the focusing on now. Like I had this grand plan. I had a path kind of laid out of what I wanted to do. I ultimately got there, but not on the path that I was expecting to follow. And it's fun to daydream and think about those things and to set the framework in place so that you can ultimately get there someday. But by being the best medical student you can possibly be, you're going to set yourself to be able to choose the residence you want to go to. And that's critically important. And then if you're the best resident that you can possibly be, you're opening up all sorts of opportunities for fellowship or private practice or academics, whatever it is that you want to do. So that's my first piece of, I guess, advice is just as much as I was in this rush, like I desperately want to be an astronaut. I kind of had to shut that down for a little while and focus on being the best emergency medicine physician that I could be. And it all ultimately worked out. But I think for our types of personalities, that can be a very hard thing to do. Now, if you have bandwidth, if you've got, your rotations are all on rails and you're getting honors and all of that stuff, and you're still looking for stuff to do, getting involved with AMSRO, getting involved with the Aerospace Medical Association, starting to meet folks at those meetings, identify what research opportunities are out there. that starts to build then maybe your aerospace medicine knowledge and network a little bit, and starts to kind of fill out the space part, and maybe we'll meet that the space part of your desire to learn. If there are extracurricular activities that you're interested in doing, or there are opportunities that you're interested in engaging in. So, Shana, or Dr. Giffords, have you had an opportunity to chat with folks about your high seas experience yet?
I don't think I have formally discussed.
Come on, you can't invite me to this and you haven't even presented to them yet.
We'll get to that. This is my launch event. You're the big show today.
Okay, well,
if people want to know about how if they want to be really crazy, they can lock themselves in a dome for 366 days. I will talk about that.
That's very kind, but so you all have to convince Dr. Giffords to talk about her high seas experience. It's I mean, there are rotational opportunities to Antarctica. There are there's the Mars Desert Research Facility. There are opportunities to do kind of fun, have fun experiences, gain some insight. I think it's University of Colorado through kind of the Mars MDRS that they have kind of an aerospace medicine mock Mars simulation CME. And so these are all kind of interesting opportunities just to learn a little bit more, but that is all icing on the cake. Foundationally, you need to focus on being the best at what you're doing right now.
Kjell's right. And there are many opportunities if you want to hear about them, and you can stick around. I know that we're all on the lunch break and we got to go back to our rotations, but we'll talk a bit about them during proper AMSRO meetings. We'll try to make sure that you guys have all the information you need to know about the UND simulator up there, to know about MDRS, High Seas, which is now Sensoria, NEMO, which is 60 feet under the water where you saw Kjell walking around. Those are all out there and available. So you can avail yourself of those, but what we've got to do right now is be the best doctors we can be and take care of the rest as it comes around.
So that was a great answer. And moving on to the next kind of set of questions, Kendall and Colin both asked more about the research side of things. So Kendall and Colin, if you both wanted to unmute and quickly ask your questions, I think they go well together.
Yeah, I was looking in the chat and was hoping you would put them together. Thank you again for sharing your experiences with us. My question was about basic science research opportunities, whether in space or on the ground, just sort of the biomedical research that's going on, because in the PhD grad school world, we don't hear a lot about that. So.
Sure. No, there are definitely research opportunities. There, as much as we have dreamed about going to Mars, and Mars always kind of seems 30 years in the future, I think that we're on the crest of something a lot bigger. SpaceX is working really hard and has a vision for Mars. But there are still a lot of unknowns with regards to human physiology and the effects of radiation, and specifically on the cardiovascular system, on the central nervous system, and what those exposures are going to mean. So I think that's a huge area of research. But we have done long duration space flight, and we've done it up for almost a year, and we have folks that have cumulatively spent 1,000 up to 1,000 days in space, and so long cumulative exposures. But it's all in low Earth orbit, and it's all kind of under, or for the most part, in low Earth orbit. We have our Apollo astronauts that went past the Van Allen belts and got more galactic cosmic radiation exposure. But there is definitely research out there to be done. It really kind of depends on your area of interest. But I guarantee you that if it has to do with the human body, we know something about it, on what it's like on Earth. There's still a lot to be discovered about the effects of radiation and long duration weightlessness. And so CASIS, C-A-S-I-S, is the nonprofit organization that is responsible for kind of surveying and vetting the research that goes up on the International Space Station. So that might be a good place to start to look at I think their website, but it's really individual universities then that have picked up the bits and pieces of focusing directly on ocular health or focusing on cardiovascular health. And so it would be like kind of trying to figure out and getting in touch with those specific labs if there's a particular area of research that you're interested in. And then again, one plug for the Aerospace Medical Association, you know, it has a very operational medicine aspect, but there is also a very basic science focus for that organization as well. And so that would be an area to get involved with and to start to network with to identify those projects. Does that answer your question?
It does. Thank you so much.
Okay, absolutely.
The resource is helpful. I'll look into it.
Okay, good.
Your question is very timely. The ISSR&D conference is starting in 3 days. I'll put the link up. It's free to register and free to
Perfect.
attend. So they'll be talking about the healthcare that goes on. And Women in Aerospace Medicine launched in August, and we have a series of speakers. We just had the head of Trish, Dorit Denoville, talk to us, and we'll have a series of people coming online, but we're trying to hook people up with mentors. So getting a mentor can also really help.
Absolutely.
Get you.
Yep.
All right.
And kind of to, I had a follow-up question to Kendall's point. Like, as you were mentioning with the planned lunar and future Mars missions by the mid-2030s, what are some health aspects that need to be solved, like in the meantime, to make those extended missions possible and safe?
Yeah, so I think that that radiation, in my mind, radiation really stands out as one of the larger challenges that we're facing right now. You know, it's really interesting. I started, my passion for space medicine really started when I was an undergrad. I wrote my senior thesis on weightlessness-induced orthostatic intolerance. It changed the passion I had for the subject changed the direction of my education to the point where I actually decided that medicine wasn't really where I wanted to go initially. And I went and pursued a master's in cardiovascular physiology with a focus in microgravity. And at that time, the community pretty much felt like we understood the challenges of space medicine. It was cardiovascular deconditioning. It was neurovestibular changes, muscle atrophy, bone loss. And that was those were the big challenges. And it's, you know, within the past 10 years, there are whole domains of things that we have discovered that are issues that we had not been previously aware of or dealing with. And ocular health is one of those. Permanent visual changes in some of our astronauts as a result of is it the atmosphere? Is it fluid shift? Is it intracranial congestion or hypertension? And so there are definitely areas that we have ongoing research, but we don't still fully understand. I would say that the biggest, in my mind, the biggest challenge right now with the greatest unknowns is probably radiation. But certainly, I think if there's a particular system that you're interested in, you know, whether it's neurological or cardiovascular or muscular, there's an opportunity for research, because again, our experience is in low Earth orbit with a space station that's only 250 miles from the Earth, with constant resupply and ability to get new materials and food and equipment up there. When we go to Mars, we're not going to be able to ship an advanced resistive exercise device, an ARED, and a treadmill along on the vehicle that goes out to Mars. So we know how to deal with muscle atrophy and bone loss in low Earth orbit, but it's a whole new challenge when you've got a small vehicle making up to an 18-month or a couple-year mission, because the resources are going to be much less. And so I would tailor your pursuits to what you're interested in, again, rather than what is the specific thing, because you may, along with your interests, you may discover a whole new realm of physiological challenge that was previously unknown.
Thank you very much.
You bet.
And speaking of discovering physiological challenges, I think we're talking about that we have time for one more question and combining two questions that had somewhat similar topics relating
Okay.
to challenges. Jennifer?
So next question, and Shopi's question is what Dr. Gifford suggested combining. So Nick asked about the physical requirements for training and physical requirements for being a flight surgeon with NASA. And then Shopi had a question about how much your medical background has played a role in your life since joining the astronaut class.
Sure, thank you. Those are great questions. So physical requirements, you can find those online. In general, the practice of aerospace medicine is space medicine. If you go back to the 80s when we were building Space Station Freedom, there was a whole module that was dedicated to medicine and physiology. There was an operating table and equipment and all sorts of stuff. That cost millions and millions of dollars. So the idea was, instead of necessarily preparing for something like that, which you hope to never use, let's fly the healthiest people possible so that we are not having to take the emergency department and the pharmacopoeia up to space station. And so we look to hire folks that are generally free of chronic disease, that are in good shape, and that in order to minimize the issues that we see on orbit. And so there are physical exams and all sorts of things to address that. The physical requirements with being a physician in NASA are generally pretty close, because the flight surgeons are essentially expected to be able to participate in some of the activities that the astronauts do. So the military model is that flight surgeons will fly in the aircraft of the pilots that they take care of, to better understand the physiological environment and to understand the stresses and the culture and all of those things to make them a better physician. Unfortunately, our flight surgeons don't get to do quite as much, but our civil servants get to fly in the back of the T-38 jet, and they get to scuba dive as guests in the neutral buoyancy laboratory, where we do our spacewalk training. And one of my favorite parts of being a flight surgeon was taking care of the astronauts as they were living and working out in Star City in Russia. That to me was really the pinnacle and the exemplar aerospace medicine experience, getting to live in that environment with the crew. So there are still some medical standards that apply to our flight surgeons. But do not count yourself out. Don't say, oh, I've got this, so that's probably not going to work, and just give up on that. If that's something that really interests you, you should pursue it and let somebody else tell you that, hey, this is disqualifying. Don't disqualify yourself. And then the last question, how has medicine helped me as an astronaut? It is really interesting, because for just about every domain that applies to is selected into the astronaut office, we have physicians and scientists, engineers, and pilots, folks that come from the operations world, folks that come from all of these really kind of STEM domains. For the most part, what it is that got you there, and so whether you were running your own lab at MIT in microbiology, or you are a test pilot flying the F-35, for the most part, what got you there is not further leveraged at NASA. So when I say that is, if you were a microbiologist, you're not going to continue to do microbiology at NASA. Your experiences and reputation and interview, they get you through the door. And then once you become an astronaut candidate, now you've got to go through the training program and do all the things that you've got to do to become a good astronaut. And so certainly your experiences, though, prepare you for the rigors of learning to speak Russian, learning space station systems, how to fly the jet, how to run a robotic arm. And I felt like my experiences as a physician gave me the tools that I needed to be successful. I'm not a test pilot, but I know how to work with a small team in a pressurized environment with incomplete information, how to evaluate large amounts, how to try and sort through large volumes of information like you were doing as medical students. I mean, the fire hose of knowledge and how to retain that and use that, how to communicate effectively, how to develop relationships with teammates, with leaders, with followers. All of those things were very, very, I felt very beneficial to me. So my experiences as an Air Force officer, as a parachute team member, as a Boy Scout, as a father, a family member, and as a physician, your background, all the things that make you can leverage those. And I feel like medicine was a great domain preparing me for this job. And so I wish you all the absolute best of luck in wherever you are in your medical journey right now, whether you're a first year or second year student, making your way through volumes of information, or if you're a third or fourth year on rotations, learning how to be a part of that clinical team and preparing for USMLEs. Or if I don't know if there were any residents, but if you're an intern or a resident on a team, taking what you learn in medical school and building upon that to become an awesome physician. I wish you all the best of luck. And I really appreciate the time to share with you all today. I hope this was interesting and informational. And if you have additional questions, please feel free to get a hold of me through Shan.
Thank you all so much. Nathan and Colin and everyone else, I see your questions. I do, and I've copied them, and we'll try to get you the answers that you've wanted. For everybody who'd like to stay around briefly, we're going to have a very brief AMSRO meeting. Kjell, I wanted you to see this picture of all of us at the last.
That's awesome.
Just for fun. Yeah, I miss those times. I miss being in large rooms with lots of people. I wish we could be all together, and I hope we will be again soon.
Dr. Gifford, thank you so much for the invitation. This was an awesome opportunity to get to spend an hour with you all.
Yeah, we really, really appreciate your time. We hope that we can see you again, one place or the other. Maybe ASMA will take place this year in Reno in May. Fingers crossed. That would be great. Thanks for coming. Take care. Everybody else, will start the meeting in a few minutes.
All right. Bye-bye.
Talk to you soon. Okay, for everybody who's still here, we have two leads in the room, Jennifer Lee and Garrett Camps. You guys, when would you like to get rolling?
I think right now.
Right now, sounds really good. Okay.
The PowerPoint. I think one of you will have to share the screen for it.
I've got you. Taken care of. Here you go, guys. Jennifer, Garrett, take it away.
Yeah, so I can just quickly read the WashU AMSRO mission statement. Basically, we're here to provide you exposure to the field, networking opportunities, and educational resources. And really, we just want to increase interest in the field, facilitate discussion of medical factors relevant to spaceflight and other extreme environments, and just talk space.
Yay, space.
Yes, there are a wide variety of things that we offer to you guys, and it's basically a lot of the questions that you had, or a lot of the things that AMSRO will offer for you is more knowledge about what things are going on in the field, more opportunities to get involved with whether it's research, going to conferences, things like that. And so yeah, that's really why, if you're wondering why you would join, it's just to get access to more opportunities to do things and get involved with space medicine.
So our first official meeting is going to be on the 22nd at 5 o'clock. Is that right, guys?
Yep.
All right, and we'll be setting up a way to subscribe to the listserv. But in the meanwhile, if anyone here wants to get on board, feel free to email one of the heads, and the emails are there. Guys, does anybody want to stick around? Have any questions for us or anything that you want to talk about? Is anyone not able to make that meeting on the 22nd at 5 o'clock, but really wants to be involved? Feel free to stick around and we can chat afterwards.
Other than that, thank you guys for coming.
Yeah, absolutely. And I can answer some of the questions, like Rachel, especially if you're still here, question about being an OT with mental health, with interest in mental health. Feel free to unmute. We can talk about it. I was locked in a dome for 366 days. So, and that was the second space simulation I was ever on. So yeah, we can definitely chat about that if you'd like, or we can talk about it at some meeting.
Yes, I am still here and would love to hear about that experience from you.
Sure. So the High Seas mission was a progressive series of missions that started in 2012. It was 4 months long. They had two 4-month missions, and then a 6-month and an 8-month. And eventually they ran the longest space simulation in US history, 366 days, substantially longer than any other. The only other longer simulated missions were Mars 500. It's a 500-day mission. So my team, I was actually called for the previous mission, but I couldn't go because I was already on a space simulation at Johnson Space Center called HERA, the Human Exploration Research Analog, which is a beautiful, fully immersive, tiny environment where you get to go explore an asteroid. Any of you listening who are professionals have the ability to go once you're over the age of 30. If you meet astronaut qualifications, you have a master's or greater in a science field. Medicine also counts, as does engineering. Architecture, maybe, maybe not. Sometimes yes, sometimes no. So I met the qualifications. Like Kjell said, you have to be healthy, no chronic conditions, no daily medications. Corrected vision is fine. Scott Kelly himself has heavily corrected vision. And then, you know, I got locked in a dome, at 600 square foot dome, which is now 400 square feet for weeks and weeks on end. They do this 45 days now. But my mission was 2 weeks. So I missed High Seas 3, but High Seas 4, but ended up on, sorry, I missed High Seas 3, but ended up on High Seas 4 for 366 days. I was the only space doctor they'd ever had actually on that mission. And it was tough. It was tough. I knew one crewmate. He was a friend from a previous mission, but otherwise we were all kind of strangers. We got sent up to Knowles, the National Outdoor Leadership School, the way the astronauts do. And we hiked through the Grand Tetons together and got to know each other a little bit, but that was it. And then we got locked in the dome together. We're very different people from France, from Germany, 3 Americans, though the cultural differences between Americans really popped because the 2 from Minnesota were very different from me being from California and Anjay being from Texas. You know, we all had different definitions of how spicy food should be. What is the definition of clean? What is the definition of early and late and loud? And all of these things turn out to be very personal and very cultural. And just like any flatmates, you know, I feel like doctors have a bit of a leg up because getting locked in a small place with smart people is kind of what we do. And it, you know, we have strong personalities and that's okay. And we're all here to get the job done. But it took a little getting used to. We definitely hit our cruising speed around month 3. Where we had to do things like get up early and prep our spacesuits because the dome, which was 8,200 feet above sea level on a still active volcano, needed to be cleaned, and then we needed to get our spacesuits to explore the volcano and go on different missions. We could only go outside in spacesuits. It was completely isolated and confined. Couldn't talk to anyone at mission control without a 20-minute delay in each direction. That's the maximum you would have on Mars, would be 20 minutes, except when the planets are in opposition across the sun, in which case you'd have no direct communication to Earth. You'd have to bounce it off a satellite. The shortest would be closer to 3 minutes. So there's always a delay talking to Mars. We just picked the maximum delay. So we were very much on our own. And my companion, the doctor on the ground at one point, got deployed to Afghanistan. So it was really just me. And boy, was that a shocker. Because you realize that medicine is a team effort. You know, you're never without doctors, nurses, techs, pharmacies, blood banks. What was I to do if somebody started bleeding out? You know, I didn't have the ability to give fluids. I didn't have anything. I mean, I had a spine board, a C-collar, and you know, a small pharmacopoeia. I didn't even have an opioid. You know, pain remediation was not a thing. We did get to do a lot of physical medicine though. Back to your question, Rachel. So me being a PM&R doc, I wasn't then, I am now, but I was always interested in physical therapy, occupational therapy, and that is so important in this confined space. You know, you're stuck in 1,200 square feet, essentially, except when you're stumbling out on the lava in a 50-pound spacesuit. And so staying in shape, not getting repetitive stress injuries, staying fit to do the job that you need to do, not becoming deconditioned in certain very specific ways was really important. And at one point I fell through the lava and really cracked up my knee. I definitely had a ligamentous injury, but I didn't have anyone to help me because there were no other doctors. So I had to train the engineer to do physical exams on my knee to help me diagnose what was wrong with my knee. And boy, did I wish I had a physical therapist with me at the time, but I did my best to rehab it. The long and the short of it is occupational therapy in space is huge. It's a huge, huge issue. Repetitive injuries are common, and even non-repetitive injuries. Everybody gets banged up. Nails from the spacesuits are disgusting. There's a special stream of air that blows out of the shoulder of a spacesuit into the hands. So by the time it gets to the hands, the humidity is 100%. Everybody's hands rots, their nails fall off. The entire plantar surface of everyone's feet sloughs off. It's really like in chunks. I'm not even exaggerating. There are incredible pictures of just the entire plantar surface of the feet coming off in chunks as you start to build weird calluses on your hands because you're no longer using your feet for much of anything. Even if you run on the treadmill for an hour or two a day, you're not really applying much force through the plantar surfaces of your feet, but you build calluses on the dorsal surfaces of your feet from hooking on, constantly hooking on. That's just a slight change because there's no gravity and we don't engage our deep back muscles. Everyone's spine assumes a curve. You gain in height, gives everyone a backache because as your vertebrae fill up, there's no gravity to cause them to compress. So everyone gains a couple of centimeters to even inches, and everybody assumes a bit of a curve, something between 10 and 14 degrees. So you're all floating like this. So everyone gets neck aches and headaches, and trying to combat that is incredibly difficult. And all the gear, even though I've thought about different ways as a physician, as a PM&R physician, to maybe design clothing and functional electrical stimulation to encourage people to engage their shoulder girdle and their pelvic muscles in a more functional way. If I cause people to stand straight, they won't be able to see the equipment. It's all designed for people doing this. It's at an angle. So it's a very interesting time to be in this field and have a mind for occupation in space. And if you're interested in that, I really encourage you to get involved. Does that answer your question, Rachel, or even help?
Yes, it does. Thank you so much. It's really fascinating to hear you talk about all of that.
Yeah, and please look into asthma. Come to the next AMSRO meeting. We'll talk about it more. But asthma, if it's not going to be in person, will be online. But you can meet people who are doing everything from space radiology to space pain management to how to environmental organizing. It's called human factors. I'm actually working on a PhD on it. How to design the environment to work with the people, the liveware and the hardware to work together for more effective living in space and less injury. And we need occupational therapists involved. So thank you in advance for your efforts. Does anybody else want to chat, talk, have anything else we'd like to say? So we're all hanging out here. Does anybody have any problems making that meeting? Can we all make the 5 p.m. 10:22 time? And last but not least, is everyone already on the listserv? And if not, could you please join? Garrett, Jennifer, do you have anything else you'd like to say?
Nope, I think you covered it all. And for those who can, we look forward to seeing you at our first AMSRO GBM.
Thank you everyone for coming. This recording will be put onto YouTube. Cheers. Thanks again for all your time. Take care, everyone.